Thank you for joining us for our noon press conference. Today is April 24th of 2020. We'll start today with Dr. Dart with the Tulsa Health Department.
Thank you, Richard. Good afternoon. As of today, there have been a total of 467 Tulsa County residents infected with COVID-19. Tragically, 27 of those have died. Our testing continues next week. If you have been exposed to COVID-19 or are showing symptoms of COVID-19, we are making appointments now. You can call 918-582-9355 to schedule an appointment. Our long-term care task force is working with long-term care facilities to do specimen collections, as we recognize this is a high-risk population, and we want to do everything possible to reduce spread within these communities. Tulsa Health Department is closely monitoring local data trends toward meeting the gating criteria reflected in the White House reopening guidance documents. The guidance released this week from the state of Oklahoma impacts personal care businesses in cities within the geographic boundaries of Tulsa County that may or may not have implemented shelter-in-place orders. We strongly encourage those personal care businesses that decide to open today in those communities to require all employees and all customers wear masks inside the business at all times. The CDC advises the public to continue to wear cloth face coverings in public settings while also social distancing. The use of simple cloth face coverings slow the spread of the virus and help people who may have the virus and do not know it from transmitting the virus to others. Tulsa Health Department will continue to provide public health data to help guide our elected officials locally on their decision to safely reopen as we approach April 30th. I know there's a lot of concern with COVID-19 and the reopening of communities. The act of social distancing and shelter in place was not to stop the spread completely. It was to slow the spread of the virus, flatten the curve, and hopefully maintain the integrity of our healthcare systems. This prevents the surge in healthcare systems who have been able to respond to individuals who need assistance with COVID-19 while still assisting those with other healthcare needs outside of COVID-19. There's still sick people in Tulsa County. As our state and communities begin to gradually reopen, we still have the responsibility to each other to continue practice social distancing as COVID-19 cases will still be seen in our community. We will continue to remain flat or plateau or not. And our main goal, of course, if we can continue to flatten the curve or plateau the curve, our goal, as I said before, is not to overwhelm our healthcare and our response systems. THD, state, and other county public health officials, healthcare systems, and our community partners will continue to work this response we have been doing through the past several weeks. I think we're actually in our 55th day of this response. We are working on industry-specific local guidance for businesses, food establishments, personal care places, daycares, nonprofits, and more. We will continue to identify and notify individuals of positive results, working with them to identify those that they might have been in close contact with from 48 hours to prior to the symptoms starting. We will work to identify all close contacts and primarily also in places of business or places exterior to them that they might have been in contact. We'll make recommendations based on each case by case for self-quarantine. We will continue to monitor those individuals through contact tracing, ensure that they do recover. As communities begin to reopen, we will continue to ramp up our epidemiology team to ensure that we have people in place to do this work so we can continue to protect the community through contact tracing and notification of possible exposure. This virus will continue to be here. It's not going away. It's still in the United States. It's still in Oklahoma. It's still here in Tulsa. That's why social distancing and taking precautions like washing your hands, wearing a mask is still important as we continue to take steps towards reopening our communities. The health of our community remains our top priority. We will continue to watch that data each day. We ask that you to remain diligent in your actions. Otherwise, the gains we made in the month of April will be for naught. I'm impressed by the amount of people complying with our guidance and local ordinances. Thank you for doing your part as we have started to see a plateau in the curve, and that's really been important. We know that this activity and this work that we've done is actually having a positive impact. It won't be like flipping a switch and going back to life that we had before COVID-19. we will come together to redefine normal. I'd like to see awareness of prevention and protection from all diseases to remain on everyone's mind from here. It's important that we remain diligent and we be aware that there's more than COVID-19 that circulates our communities. Those things that we can do to protect ourselves will not go away. Public health efforts in Tulsa will remain as we have always been. Our mission continues to be to improve the health and well-being of all Tulsa County residents as we work hard right now to keep everyone in Tulsa County safe. At this time, I'd like to introduce Mayor Bynum.
Thank you, sir. Please stand by. Please stand by for a minute. We're waiting for our technology to catch up. Okay, while we're waiting for Mayor Bynum to be reconnected, we're going to go to County Commissioner Karen Keith. Sorry, Karen, we put you in front of Mayor Bynum. Please welcome County Commissioner Karen Keith.
Thank you so much. And I remembered to unmute myself without the mayor's help. I wanted to talk about some things that are kind of positive off the top here. I think everybody remembers a year ago, we were all hands on deck fighting record-setting rains that flooded our neighbors and threatened to take out our levees. Well, just like in today's pandemic, our mayor and regional cities pitched in to help out. And admittedly, the levee took a major hit and is compromised. So our local Corps of Engineers team and levee director completed the needed feasibility study in record time. And the U.S. Army Corps of Engineers Lieutenant General Todd Simonite signed the chief's report, the feasibility study, a crucial milestone for the project that signals the next step to getting the much needed funds to rebuild this 70-year-old levee. Brian Taylor, our civil project leader at the Tulsa Division Office for the Corps, he said this yesterday. He goes, "It's finished." It's a huge congratulations to each of you for your unmatched hard work, dedication, and tireless efforts toward completion of this precedent-setting feasibility study. And it's the first by this office to get a chief's report to be signed in 40 plus years. So to Mr. Taylor and our federal delegation, I am saying thank you. Senator Inhofe long led the effort for the levees, and Senator Langford was tenacious in his advocacy. And this is good news, so thanks go to so many. In addition, Tulsa County was awarded a $3 million grant from the Federal Economic Development Administration to modernize 5 existing pump stations on the levees. Now, the announcement could not have come at a better time, and I want to again thank Senators Inhofe and Langford for their leadership, support, and advocacy to secure these funds. As many of you know, the Tulsa-West Tulsa levees are even more compromised following last year's high water event. This grant will help us begin the replacement of this 70-year-old equipment, none of which functioned under the pressure of the heavy flows in 2019. Functioning pump stations are critical as we continue to push for the funding needed to rebuild the entire levee system. Now, Tulsa County will be looking at expenses incurred throughout this pandemic as we judiciously apply the coronavirus relief funds of around $113 million wired to us from the U.S. Treasury Department yesterday. Now, these funds are to be used for expenditures incurred by Tulsa County from March 1st to December 30th. For example, they could potentially fund issues at the election board, the courthouse, jail, sheriff's office, Social Services, the Family Center for Juvenile Justice, the Health Department, TEMA, Expo Square, Parks, and many others. Now, once we've reimbursed our county offices for all the past expenditures, we will move forward in developing a comprehensive mitigation strategy using the U.S. Treasury guidelines. Now, that said, our Parks Department has informed us that when they're given the okay, they're going to open our golf courses. And staff say they can have it done in as little as a half a day. They've also identified additional social distancing protocols and practices for disinfection and cleaning of equipment to continue the slow spread of COVID-19 while allowing people to get outside and enjoy the game of golf. And I'd like to take a moment to thank our park staff for continuing their maintenance and upkeep, not only of our golf courses, but also the rest of our parks. So if you haven't seen it yet, check out their new video series on Facebook highlighting some of our park staff and the work they do. And a quick shout out to Morton Comprehensive Health Services. They anticipate delivering over 2,000 meals for Meals on Wheels this week, up from 1,700 last week. In addition to all the other work they do to support our healthcare infrastructure, Morton is continuing to transport patients daily to appointments for dialysis, for prescription pickup, and for COVID testing. So thank you to all the staff at Morton for making all this and much more happen. Lastly, I want to remind everyone that the OSU Center for Health Sciences drive-through testing hotline number is 918-599-5300. And the OU testing hotline is 918-619-4980. And the Tulsa Health Department is doing their drive-through testing at Expo Square. You need to call 918-582-9355. If you have symptoms of COVID-19 or you've been in contact with someone who tested positive, you can call one of these numbers to be evaluated virtually by a physician and then scheduled for testing. Appointments are required for any of the drive-through testing so that our healthcare providers can ensure those that need a test get one and that social distancing practices are followed. Now, get creative with your masks and be sure to wear them in public. Make it a fashion statement, but whatever you do, absolutely wear them. So I'd like to introduce Tulsa County Sheriff Vic Regalado or bring our mayor back. Richard, which one is it?
I think we've got our mayor back, so I'm going to try for him. And thank you very much, Commissioner. We'll see you in just a minute.
Thank you.
All right. I think we've got him now. Tulsa City Mayor G.T. Bynum.
Thanks, Richard. Banner day for Zoom in Oklahoma governmental meetings last 24 hours. 6 weeks ago tomorrow, we initiated a ban on large events in Tulsa. Shortly after that, we closed restaurants and entertainment venues. 4 weeks ago tomorrow, we began our shelter-in-place initiative in Tulsa. As a community, we took all these steps to save the lives of our neighbors. And we saved those lives by practicing social distancing, slowing the spread of COVID-19, and protecting the capacity of our healthcare system to properly treat those most in need of care. We also did so to give our local healthcare system the time it needed to secure proper equipment and establish proper procedures to protect healthcare workers while treating those in need. Faced with a virus which no Tulsan was immune, we had to act quickly and in an unprecedented way to avoid a sudden overload of our healthcare infrastructure locally. The commitment of Tulsans to social distancing at a local basis and those measures that we put in place over the last 6 weeks have accomplished all of the goals that we set out to accomplish when we put them in place. According to the hospital leaders that I've spoken with here in Tulsa, our hospitals now have a proper supply of protective equipment. They've seen a decrease in hospitalized COVID-19 patients over the last 3 weeks. and they're comfortable with their capacity to handle increased demand moving forward. We've driven overall illness rates below projected levels, and our death rates per capita in Tulsa remain low compared to many of the major cities you hear about on the news because of our early action. I want to thank every Tulsan who sacrificed over the last 6 weeks to get us through this crucial period, and especially those who've lost their jobs. The road to economic recovery will be long, but we must support one another throughout it. I also think it's very important to recognize the many workers who did not have the option of social distancing because they work in a business designated by the state as being essential. These Tulsans have gone about their daily lives with elevated risk to keep our community and their industries going. And I want to thank one group that I don't feel has received enough credit through all of this: tribal governments that overlap with Tulsa. You always remember those who stand with you in a difficult time, especially when they don't have to. And I hope Tulsans never forget that Chief Chuck Hoskin Jr. of the Cherokee Nation, Chief David Hill of the Muskogee Creek Nation, and Chief Jeffrey Standing Bear of the Osage Nation did what they had to do to protect Tulsans in this challenging time. Last week, President Trump announced a framework for communities to re-engage their economies through a carefully phased rollback of social distancing measures. And on Wednesday, Governor Stitt announced a plan for Oklahoma based on a similar premise. As I told Governor Stitt in advance of his announcement, I'm thankful for his development of uniform statewide guidelines for industries to follow. One of the challenges in establishing social distancing practices at the outset of this pandemic was that in the absence of action by the state government, cities were forced to form an uneven patchwork across the state of Oklahoma. Having a uniform standard would have been better from the start, and I'm thankful that we'll have one moving forward. I believe the guidelines that the state is rolling out will help reduce risk as we re-engage our economy. Aside from the substance of the rollbacks and what they look like, the other issue, as we've talked about in these meetings before, is timing. And this one, for us in Tulsa, is more challenging. The Trump administration recommends several criteria to meet before initiating a phase 1 rollback. Among these are hospital capacity, which our hospitals tell me they have, and robust testing for healthcare workers, which the state tells me we have. The White House recommends 14 days of declining test cases before initiating the first phase of rollbacks. And according to the Oklahoma State Department of Health, Oklahoma meets that benchmark. This is great news for all of us as Oklahomans, and I don't think we'd be there if it weren't for the action taken by our metro areas during this pandemic event, and it's why the state's first phase of rollbacks is announced to start today. The challenge is that according to the Tulsa Health Department, Tulsa County has not yet met that final criteria. According to the Tulsa Health Department, our cases in Tulsa County over the last 14 days are in fact trending upward, not down. If we were to follow the federal standard locally, we would wait for the 14-day decline to occur and then begin rollbacks. But Tulsa does not exist in a bubble. We do not get that choice. Because of the state government's initiated rollback and the willingness of other communities in the region to follow it, we should expect more people to come in contact with one another, and we should expect the virus to spread at a more rapid pace in our metro area. As a result of that increased regional activity, our local health experts tell me that Tulsa's cases will not go down, they will increase. Waiting on those cases to decline as people for 100 miles in every direction are being encouraged to ease social distancing would be futile. Tulsans have already undertaken an unprecedented system of sacrifice to slow the spread of this virus in our community. While hard to do, most of us followed that plan because of the logic behind it pointed toward it being effective. And every indicator is that it was. I cannot in good conscience ask Tulsans to continue making these extreme personal and financial sacrifices at such a level in pursuit of a goal that will be impossible to reach in any reasonable period of time. It's also important to remember that the virus, as Dr. Dart just said, will not disappear on May 1st or any time in the foreseeable future. The point of our work over the last 6 weeks was to buy our healthcare system the time it needed to prepare for that long haul and to avoid a sudden surge that would overwhelm our healthcare system. After discussions with the leaders of each of our major health systems in Tulsa, I've heard from every single one of them that they're confident in the ability and in their ability to move forward and care properly for Tulsans as phased rollbacks occur. So our goal for the future is to continue managing risk as best we can while helping Tulsans go back to work safely. Our Safer at Home order will remain in effect through April 30th, at which time it will conclude. Effective May 1st, new order will be in place that reflects both the federal and state guidelines for phase 1 rollbacks. Our shelter-in-place policy will discontinue at that time. The state's guidelines for industry will be enforceable, and social gatherings should be restricted to less than 10 people in accordance with federal recommendations. This order will be adjusted when the state determines that phase 2 is to take effect. As we move forward, each of us should continue the same strategy we've deployed to date. Focus on the things that we can control. Heard from a lot of business owners who are concerned about reopening safely. If you don't feel you're ready to open with precautionary measures in place, we'll support you when you're ready. Thank you for putting the safety of your employees and your customers first. Employers should continue to facilitate remote work throughout phase 1 as much as is possible with business operations, again, according to federal guidelines. We'll continue to do that at the City of Tulsa. We should all wear masks in public, not as a sign of terror that we might contract the virus, but as a sign of respect to our neighbors that we may be carrying the virus without knowing it, and we're wearing a mask so that we can help reduce our ability to contaminate others. Non-essential travel should continue to be minimized, and if you're over 65 or have a compromised immune system, you should follow the state's Safer at Home order. For city park facilities, playgrounds, and recreation centers, they will remain closed. City pools will not be opened this summer, and day camps at city parks are canceled this year. Golf courses and tennis facilities will be reopened on May 1 with the safety precautions in place that Commissioner Keith mentioned a moment ago. The White House guidelines are really helpful. You can find guidance for individuals and employers through each phase of the rollback at whitehouse.gov/openingamerica. While our testing capacity has improved, we still have a long way to go before it is as accessible as it should be, and we will continue to work on this at a local level. And while the Tulsa Health Department established contact tracing with the very first positive case in our community, they're going to need more technological support and staffing as this virus spreads, and we will continue to pursue both. While I'm disappointed that Tulsans were not given the opportunity to position our city at a level of safety recommended by federal authorities, I'm grateful we've made as much progress as we have, and we've given our healthcare system the chance it needed to manage a prolonged pandemic event. It isn't ideal, but I know Tulsans will make the best of the circumstances that have been handed to us. That's what we always do. To that end, Tulsans in our everyday lives have taken the necessary precautions to protect ourselves and our families. The need for that does not change as we move forward. The statewide guidelines for industry are important to follow, and we should all continue to practice caution, social distancing, and proper hygiene in our personal lives. In closing, I want to thank all of those in our healthcare community who will tend to the sick and dying throughout this pandemic event. The actions of most in our city have shown you how much we support you. And I want to thank every Tulsan who's put the lives of your neighbors first. Your actions over the last 6 weeks have been part of one of the great collective humanitarian efforts in history. And all the local metrics I have seen indicated that you saved thousands of lives, the lives of people in this community who will never know to thank you, because your service to them was the absence of illness in this crucial period at the outset of a global pandemic event. Thank you. I'll now turn it over to Sheriff Regalado.
Thank you, Mayor. Please stand by. Tulsa County Sheriff Vic Regalado.
Thank you, Mayor. Thank you, Richard. During my last update, I announced that we had had a dispatcher test positive for the COVID-19. Today, I am extremely pleased to announce that she has fully recovered and, in fact, returned back to work 3 days ago. So we're very happy for that, happy for her family. Unfortunately, today I also have to announce that we had a staff member, a clerk that works within the jail in the program section that unfortunately tested positive for COVID-19. She worked exclusively with our chaplain as a clerk and had limited access to our inmate population. But nonetheless, she is home recovering, and our chaplain fortunately was tested negative for the COVID, and thus far, the overwhelming majority of the sheriff's office as a whole remains infection-free. Our inmates continue to be infection-free, as well as our detention staff, thankfully. Moving forward, we have added a licensed mental health practitioner into our safety pod area of the jail to assist in the mental health of our inmates that are going through their 14-day isolation before they enter into the general population of the jail. And that individual will start today, in fact. Our inmate population is slightly increased to about 1,014, which equates to about 49.6% of our jail capacity. And that directly correlates, I believe, to what we've seen and have reported to us from our deputies in the field, a increase during the COVID-19 and domestic violence calls and or arrests. So that continues to be a concern, and I would remind people that they can still call Family and Children's Services for guidance and information, and that violation protective orders are still in place, and you can obtain one and receive help in obtaining one when you call a deputy or police officer. They will assist you and ensure that the paperwork is turned in properly so that you can receive a protective order for yourself. Again, we're very thankful that we remain all in all infection-free. We continue to deploy all of the safety precautions that we have from the very beginning, and I believe that has truly been made an impact in terms of keeping not only our deputies, detention staff, and inmates infection-free. So we will continue with that indefinitely, and hopefully move forward and get past this just like the rest of Tulsa will. With that being said, I would like to again thank our first responders, our health professionals, and detention staff for their commitment and the unbelievable work that they have done during this crisis, not only for the sheriff's office and David L. Moss, but for the citizens of Tulsa County. I've really seen people step up, as you do in any crisis. Leaders seem to move to the forefront, and we've certainly seen that here at the sheriff's office. So thank you, and I wish everyone in Tulsa well, and as we move through this crisis. Thank you.
Thank you, Sheriff. Please stand by as we bring our other speakers back. We'll now be taking questions from the media.
Our first question is from Mayor Bynum from Fox 23. Does your order of banning groups of 10 or more conflict with the state's comments of churches reopening as long as they only allow people to sit in every other pews? Is Tulsa going to still recommend churches stay digital or in parking lot settings?
We're not going to have an issue that conflicts with the state's guidance.
Okay. Our next question is for Dr. Dart from Channel 6. The state says they are using a 7-day rolling average to monitor case numbers. They say using that model, the cases have gone down since April 7th, which meets the White House guidelines. Does the Tulsa Health Department use that as well? And are your numbers different from the state?
Is that, can you please repeat that? You were cutting out and I couldn't hear the question.
Okay. From Channel 6, the state says they are using a 7-day rolling average to monitor case numbers. They say using that model, the cases have gone down since April 7th, which meets the White House guidelines. Does the Tulsa Health Department use that as well? And are your numbers different from the state?
So remember, we're monitoring that information in Tulsa County, and we're actually doing it on a 4-day with 4-day rolling numbers. And so the Tulsa County numbers, while we're expanding testing, so I guess we're not surprised to see that our numbers are actually trending upward, which we expect when we do that. The important information is that we're getting between a 7 to 8% daily positive rate, which is good, because if it was higher, we'd be, I think, a greater concern. But we're focused strictly on Tulsa County data. We're doing 4 days of rolling numbers. We think that we've got our data is an accurate reflection of true viral activity in the community, and we'll continue following our modeling and do that work here.
Okay. Channel 8 for Mayor Bynum. As cases trend upward, are you concerned that sick people from outside of Tulsa, where restrictions are looser, will put undue pressure on Tulsa's hospitals?
Well, I think there's 2 questions there. I mean, one is, am I concerned that people in communities where restrictions have been loosened will impact Tulsa? The answer is yes. But that is also why I think it is futile for us to try and keep a strong social distancing policy in place here that places such a heavy personal and financial burden on Tulsans when everyone around us has abandoned that practice. So there's that side of it. On the hospital side, after talking with the leaders of our major hospital systems in Tulsa, I have a great deal of confidence in their capacity to handle what we should expect coming forward as we do a phased rollback. Each of them assured me that they have a high degree of confidence in being able to handle what they expect to come moving forward.
Okay, thank you. Fox 23 for Dr. Dart. According to the last update we got from you, we have not peaked yet on infections. Are we just opening the floodgates for more infections than if we just waited a few more days?
You know, we're seeing a consistency in the number of cases that are reported each day, which is higher than we'd like, but it's also lower than what could be happening. And yes, I'll be honest, my preference would be that we actually give us more time to do more testing and evaluate the data more thoroughly, but we don't really have that time. So that's why it's really important that we talk about what people can do to continue to protect themselves, can continue the social distance, to really pay attention to personal hygiene, and be very careful about gathering together. We still know that groups are a way to increase the chain of transmission. So those guidelines and those recommendations to protect yourself will not go away. Frankly, they won't go away probably through the rest of this year. This virus is here and it's going to stay here.
Okay, Fox 23 for Dr. Dart. We've heard talk here and there about the term herd immunity. Are we headed in that direction now? Is that a reasonable approach for Tulsa County?
You know, we count on herd immunity to prevent the transmission of any disease that can be transmitted from person to person. And we're extremely early in this outbreak. So we know that right now we don't have the capacity or the depth of herd immunity to protect people who are not immune. And that's something that takes time to build up. And frankly, it's going to take probably 1 to 2 years to actually reach a level. We look at anything between 60 to 80% of people having an antibody who are immune, so they can protect those who aren't, and that takes a while to build up.
Okay. Tulsa World for Mayor Bynum. To be clear, are you saying that you would have preferred to keep your shelter-in-place order in place longer, but feel that it would be futile because the state has already begun reopening the state?
I would like to follow the guidance that the White House issued last week that said that we should have 14 days of declining cases in a community before you start rolling things back. That's the standard not just from the White House, but a range of other studies that I've heard. But again, the reality is Tulsa does not exist on an island. We are surrounded by the state of Oklahoma. We're part of the state of Oklahoma, and the state of Oklahoma and communities all around us are starting to relax their social distancing practices today. And so I can't ask people that work at a restaurant in Tulsa to remain unemployed while we try and pursue a 14-day decrease, while restaurant employees in every community around us and for 100 miles around us are getting to go to work and contracting viruses and bringing them to our community. That's not fair to Tulsans, and it would be asking them to make a great economic sacrifice in pursuit of a goal that we would not be able to achieve because we don't exist in a vacuum. We are in a region, and we're not on an island by ourselves. And so that's what I have preferred, that we allow Tulsa and Tulsa County to hit that federally prescribed benchmark. Absolutely. But we weren't allowed to do that. And so I think the proper thing to do moving forward is to try and manage our risk to the greatest extent that we can. I will say one thing that gives me consolation in all this is the reassurance from our hospitals that they have the capacity to handle this moving forward. And so, that was one of the main reasons that we initiated this process, was that we didn't want our hospital systems in particular to be overwhelmed. And we've positioned them to be able to avoid that, thanks to the work that Tulsans and people in the Tulsa metro area, the sacrifices that those people made over the last 6 weeks.
Okay, Channel 2 for Dr. Dart. What was your recommendations to the mayor regarding lifting the city's shelter-in-place order?
In all honesty, it's right now or today, I think it's too early. I mean, the data is still telling us that we're getting advanced viral circulation through our community. We're not seeing a decrease in our daily test numbers. We're testing more. As I said, we expect to see positive results, but our positive results are trending in the wrong direction. My preference would be that we actually waited. But as Mayor said, we don't exist in a bubble, and we have to be cognizant of all the communities in Tulsa County and make sure that everyone in Tulsa County can operate and function and make decisions on a level playing field. And I think that's what's happening today.
Okay. Fox 23 for Mayor Bynum. If numbers get out of hand as we reopen, will you consider putting more restrictions back in place in the future?
Well, of course, but I would also say that two things. The governor gave me his assurance that the state is tracking that data moving forward, and if they detect a spike in cases, that they will halt rollbacks and they will respond accordingly. Take him at his word on that. The other thing I would say is that's one of the reasons that I'm asking that we wait until May 1st to roll back our own orders and fall in line with the state. The governor said that he wanted the opportunity to have this first round of rollbacks that are occurring today in a lot of communities around the state of Oklahoma to see what kind of impact that had from a case standpoint. And I want to give the state a week of looking at that kind of data to make sure that they're 100% confident that May 1 is the time to be moving forward with the further part of phase 1 under their plan.
Okay. Sheriff Regalado from Channel 8. Have you seen a difference in the number of crimes happening while Tulsa was under a stay-at-home order?
Yes, as I stated earlier before, we've seen a rise in domestic violence calls, especially in the last 2 to 3 weeks. It's been a steady incline, not only in calls for service, but arrests. So that was probably the main difference. We've also started to see a slight uptick in burglaries from vehicles and residential burglaries. Slight, but still an increase. So those are probably the two main crimes that we've changed since the COVID-19 crisis.
Okay, and our last question is for Sheriff Regalado from Fox 23. At what phase of reopening do you think in-person jail visitation will be accepted again?
It's difficult to say. I think that we will closely monitor how Tulsa moves forward and fall in line with the phase one more than likely. But the jail is a slightly different animal, as I stated in the past. We're susceptible to a serious outbreak because of the close vicinity within the jail, the lack of social distancing, and things like that. So a positive COVID in the jail has the potential of being catastrophic. And although the mayor and Dr. Dargett said that our hospital system is fully prepared in the event of an increase, we don't want to add on to that. So I think we're going to take it day by day. I can't give you a definitive date, but moving forward, we want to ensure that when we do open that up, it is not to the detriment of our staff, inmates, and most importantly, Tulsa.
At this time, this concludes our press conference. Thank you very much.